Okay, so this is a presentation over trigger finger. The anatomy of trigger finger is basically the entire hand, so the bones of the carpals, metacarpals, and phalanges. The joints are the distal interphalangeal, the interphalangeal, and the proximal interphalangeal, depending on whether it's the thumb or the actual fingers, and then the metacarpal phalangeal. The muscles and tendons are the flexor digiti minimi brevis, flexor digitorum profundus, and flexor digitorum superficialis. And then over top of the tendons are the tendon sheaths, which are the part that becomes inflamed, which prohibits the motion and causes the actual trigger finger. The pathology is that the tendon sheath surrounding the muscle becomes inflamed, and then the finger gets stuck in the flexion position and is unable to extend. This is caused because of the scarring, the thickening of the tendon, or the nodules can form. Mechanism of injury, mostly it's an overuse injury, so repetitive motion such as piano playing or any sort of activity from any careers. Hormonal issues can cause a problem. Estrogen is one of the main hormones that can affect this. That's why it's more prevalent in females. And acute trauma can also cause the tendon sheath to become inflamed. Signs and symptoms are fingers stuck in flex position, lumps in the velar surface, and popping and clicking with finger movement. There's only one special test for this, and it's just called the trigger finger test. You basically have your hand laying flat on a table, wide open, and then flex the fingers repeatedly to try to get the finger to trigger. Differential diagnosis, there's multiple things because the hand is a very complex body part. One of the main ones is that ligament can just be catching on a bone. There's also lacerated flexor tendons, loose bodies in the joint, arthritis, and Dupuytren's contracture, which will be covered in other presentations. Predisposing factors for this, I already mentioned that being female is one. Occupations requiring repeated gripping, such as piano playing. Diabetes and arthritis are different diseases that can affect this. And having carpal tunnel syndrome surgery can also be a predisposing factor. Management and treatment. The main one is NSAIDs. You want to rest it and prevent from all the motion causing the inflamed tendon to become even more inflamed. So splinting, icing, and then to prevent it or to rehab it, you want to do stretching exercises. Referral and immobilization. Again, you can splint the finger to prevent movement. You can have surgery to cut open the part of the tendon that is affected. That way it releases all the pressure and everything that's causing the triggering. The percutaneous release, which is very similar to dry needling, and then steroid injection. Prevention, as I mentioned before, you can do finger stretching, you can do finger mobility exercises, and you want to limit long periods of gripping. There's no mulligan technique for this condition. And then my PCOT is here, the link's here, and you guys can watch that. I won't waste your time with it. And there's my references.